When the stakes are high, truth matters most, especially when it comes to your health.
I absolutely see it as a public health issue. Misinformation and disinformation.
How to separate fact from fiction. Right now, our nation's top health officials are addressing that with WUSA9. How confident are you in Americans' abilities to confront the next public health crisis? Also tonight,
I'm busting the myth that carbohydrates are bad for you.
We're learning the facts from the pros you turn to about staying healthy and the people impacted by the big health stories.
I found out that I had this virus and it was like a really big deal.
We'll verify the answers to questions you asked, like can drinking alcohol really shrink your brain? And who's to blame for skyrocketing prescription costs?
You need it. If you don't have it, you're going to be hospitalized.
Medical myths and misinformation. A WUSA9 Verify special starts right now.
And good evening. Through the next half hour, we are looking out for your health. I'm Adam Longo.
And I'm Abby Larico. Our goal is to empower you so you can make more informed medical decisions.
First, though, let's get into how we do what we do. When we verify, it means the information you're getting is 100% accurate. You don't have time to fact check and get lost in a maze of internet rabbit holes. That's where our Verify researchers come in.
With more COVID news comes more COVID misinformation.
We are your personal misinformation firewall. And for the next half hour, we're focusing exclusively on your health.
I'm Ralph from Gaithersburg.
Can you verify?
I want to know.
Is it safe?
You see our sources up front. We'll take you step by step through our vetting process so you can be confident the information you're getting is the truth.
Walk me through what you guys do here.
Our Verify researchers track down original documents, we analyze studies, and we go straight to the top medical experts in their field.
An endemic disease is one that's always around.
Stomping out misinformation online and answering your questions.
We can verify it's true, so we can verify knows.
So you can make informed decisions about your family's health.
With your Verify,
no agenda, no spin, nothing to hide. This is Verify. So we start with this tonight, COVID-19. Most people who get it, they recover in just a couple of weeks. But some people, even with those mild cases, still have symptoms weeks, months, and even years later.
Right. This is called long COVID. So what do we know about it? Our Matt Gregory went to the experts to verify.
We do like a quick assessment of their mood experiences, like I'm happy.
When you meet Ashley Williams,
my focus is a 3.
The term active feels like an understatement.
There's an algorithm here that recommends resources from our resource library that meets them exactly where they are.
After all, she spent the last few years launching a tech startup.
We're also collecting emotional intelligence data.
A company that uses software to help young people with their emotional health care. Climb.
It was just an issue close to my heart.
The goal is to help children develop emotional intelligence and resilience. And ironically, that was a skill set she was forced to put to the test in March of 2020.
I'm living my life, and then all of a sudden, I can't get out of the bed on some days.
The world had just heard about a deadly virus, and Ashley developed peculiar and severe symptoms.
I didn't want to get out of bed. I just felt not well. I didn't have a fever. I had some digestive issues, a really bad headache. And it sort of spiraled.
Her family took her to Johns Hopkins University Hospital, one of the few places in early 2020 that could test for COVID, and she came back positive.
I found out that I had this virus, and it was like a really big deal because at the time, when people were going into the emergency rooms, they were not necessarily leaving out of them.
She went home and started to recover, and eventually she tested negative, but
I was chronically lethargic. I had incredibly bad brain fog, just difficult. My body would be racked with physical pain. I would have pain that would sort of radiate through my legs and my fingers. My joints ached. Sometimes if I ate, I would vomit or I would get ill.
It's what doctors now refer to as long COVID. So let's verify. What do experts know about long COVID? To get a basic idea, we went to the CDC and the World Health Organization. Both define long COVID as having a range of continued or new symptoms that can last weeks or months past your initial infection, with the WHO saying you've got long COVID when you hit that 3-month mark.
The most common is fatigue, the sort of inexplainable fatigue.
Dr. Priya Dougal is an epidemiologist at the Johns Hopkins Massachusetts University Bloomberg School of Public Health. And for the last 2 years, like most medical researchers, she and her colleagues have studied COVID.
And then early on, we also started to see people reporting symptoms that were long-term. And so that was another question is, are there a lot of people really having long-term symptoms? Can we try to answer some of those questions? Can we get at it?
And that's when they came up with the idea to do a long COVID study, a simple online-based questionnaire that anyone can take. And one of the first people to take the study,
how many times have you tested positive for COVID-19?
Was Ashley Williams.
What type of test did you take when you tested positive for COVID-19 the first time?
The survey asks a number of different questions and then gets to the heart of it. What are the symptoms or conditions you continue to deal with? And Ashley has a laundry list.
I found out that I ended up developing celiac disease. What? I also developed moderate asthma. Then I also developed fibromyalgia, which is sort of like this neurological issue that can send waves of pain through the body.
Dr. Dougal says their goal is to get 25,000 people to participate. That way they have a broader idea of what COVID long haulers experience.
We want to figure out these anomalies, like why are some people different than others?
Despite the symptoms, Ashley's back on track, working tirelessly on her emotional healthcare startup, but also trying to help people just like her.
My hope is that through the participation of the study, that information comes forward that can help, so people won't have to suffer in the way that I suffered.
I'm Matt Gregory, WUSA9.
Now, we checked in with Ashley for an update, and she says that celiac, asthma, brain fog, and fibromyalgia are still her daily reality.
But she says she's developed a treatment plan that works for her.
That took a lot of learning, like in having to understand this new body and what this new body requires and how much rest does this new body need and what are the right foods to consume for this new body and what is, when do I take my medicine and remembering to take my medicine. But, gratefully, that part of the journey I've walked, and now I'm just sort of on the path of maintaining my health.
Now, Ashley has a message for people watching her story. She says, be an advocate for yourself. If you don't feel well, speak up and keep looking for answers.
Around the time so many of us were told to stay home, Dr. Anthony Fauci became a household name. The White House medical advisor, for better or for worse, became the face of America's response to the COVID-19 pandemic. Before retiring this month from the National Institute of Allergy and Infectious Diseases, after nearly 4 decades as director, he sat down with us. Dr. Fauci, thank you so much for your time.
My pleasure. Good to be with you.
We are talking about misinformation here on Verify. Do you see misinformation as a public health issue?
Oh, I absolutely see it as a public health issue. Misinformation and disinformation in so many areas, but take one, for example, the misinformation and disinformation about vaccines, denying its rather substantial efficacy in saving lives and its safety, which is a very, very good safety record. Misinformation that steers people away from getting a potentially life-saving vaccine for COVID, for example, could truly lead to a loss of life.
Sometimes, though, the misinformation may come from old information. Of course, we saw changing guidance over how long quarantine should be, who could get COVID, how you get COVID. The CDC has admitted some communication missteps throughout all of this, and it's led to some people pushing back on healthcare regulations and guidance. It's led to some people just being burned out on paying attention to any of it.
So what we need to do is to make it much more clear that when things are said on the basis of data that you have at a given time, you've got to always realize that that information could change next month or 6 months from now. And that's really the nature of science. It's self-correcting.
How confident are you in Americans' abilities to confront the next public health crisis, given our response to the current one?
Well, if we learn the lessons that we should have learned from our experience with the current outbreak, as well as prior outbreaks, we can do much better and be prepared. There will be subsequent outbreaks. It may not happen next year, it may not happen 5 years or 10 years from now, but it will happen. We just need to use the lessons that we've learned from prior outbreaks to help prepare us for the future ones.
the beginning of your answer to that question was if we've learned the lessons. Do you believe we have?
Well, I hope so. We'll have to just wait and see. One of the problems is that people and countries' corporate memory often fades when you distance yourself from the event that you were concerned with, and people tend to focus on what the current real and present danger is and not what might happen next year or the year after. That's why it becomes difficult to convince people that we need to have a perpetual readiness for the next outbreak.
We're not going to see as much of you on our televisions as we have gotten used to over the past few years, but people are still going to be seeing TikToks, Instagram videos, tweets, and whatnot.
I would stay away from learning from tweets and maybe learn from authorities.
This conversation about misinformation is so important, and just so important to get people to drill down where are they getting their information and are they confirming it through more than just one source.
Right, and I really appreciate what he said about being flexible and understanding the nature of science is that sometimes things are going to change, and so it goes to show how important it is to just keep paying attention.
Yeah, got to stay on top of these things. Well, moving forward tonight, we're also going to be sharing some wisdom for some other health experts.
Like this quick tidbit from a personal trainer.
Hi there, my name is Laurent Anzalai. I'm a strength conditioning coach here in the Washington, D.C. area. You know, one of the biggest myths I hear is about spot reduction. So for example, if you want to slim down your core, all you have to do is thousands of crunches every day, right? Wrong, that's not how it works. You see, when your body loses weight, it does so evenly. And in order to do that, what you have to do is follow a healthy diet, exercise regularly, which includes strength conditioning, cardio, and mobility drills. Of course, genetics play a little role in this. So start small, enjoy the process. My name is Laurent. I'll see you soon.
It is vitally important to know that the information you get comes from reliable sources. That's where Verify comes in, to sort out fact from fiction and to make sure you're getting the absolute truth with no spin.
Breast cancer awareness means knowing the facts.
Tonight, our Verify researchers are helping you sift through health misinformation to help you make informed decisions.
So the internet is full of helpful information, but it's also filled with plenty of garbage. Verify helps you sort through that, and here are 2 ways we do it that can help you at home as well. All right, so we're always hearing about the latest exciting health study, right? The health benefits of red wine, or how eating chocolate helps your brain. Well, how can you know if these studies are legit? So here's a few things that you need to look out for. First, ask yourself and find out, is the study peer-reviewed? That means experts in that field have rigorously reviewed the research and methods used by the study's authors. If a study isn't peer-reviewed, you shouldn't be giving it much weight. And secondly, find out who paid for the study. If a new study shows that your favorite soda could help you lose weight, but it's your favorite soda that paid for that study, well, that would have us raising a few eyebrows. So remember, if it sounds too good to be true, it probably isn't. Abby?
Hey, Adam, thanks. So the cost of insulin is on the rise. So what does this rising list price mean for you if you have diabetes? Well, it depends. If you have good insurance, this might not impact you, but it will mean a much higher price tag for many out there. So up next, we dive into who exactly is affected.
Hi, my name is Rafa Bushi, registered dietitian, and today I'm busting the myth that carbohydrates are bad for you. Many people think that carbohydrates are just breads or pasta, and don't realize that a lot of the foods that you eat, such as fruits, beans, starchy vegetables, whole grains, and yogurt, are carbohydrates, foods that are rich in nutrients, vitamins, and minerals. Carbohydrates also give us energy, just like gas for a car. You wouldn't want your car to run empty, so why would you?
We've heard a lot of claims that insulin costs just $10 to make one life-saving vial, but drug companies charge families about 30 times that amount. So let's verify. Is it true that insulin is made for just dollars, but is sold for hundreds? Here's Evan Kosloff with how we got the answer.
Where's the ghost? Oh no.
Ali Popel works 3 full-time jobs.
Excuse the mess as always.
At an IT company, as a realtor,
Dinosaurs coming.
Whoa.
and as a dad.
This is my son Aaron. He is now 11 months.
But to do anything, he first needs to make sure that his glucose is in check.
I'm type 1 diabetic. I'm insulin dependent, so my pancreas does not produce any insulin.
Without it, he could go into what's called diabetic ketoacidosis, or DKA, which could lead to a coma.
So this is
life-saving. It's food, water, insulin for you.
I need it like oxygen, yes.
And right now, Ali is paying under $50 to get 5 vials of insulin. But back when he was unemployed and uninsured, he says he would pay anywhere from $400 to $800 per month, which is why he wants to know.
Why does it cost so much?
So let's verify. What explains the cost of insulin? For answers, we spoke with Gerard Anderson, a professor at Johns Hopkins University.
It's a very, very complicated supply chain.
And Dr. Robert Lash, the chief medical officer at the Endocrine Society. Our team also read this 269-page report from the U.S. House Oversight and Reform Committee and watched a 2019 congressional hearing on this exact subject. And according to our two experts, $10 to $25 is a fair estimate of the cost to create insulin. Although Dr. Lash referenced this study, which says that a vial of insulin could cost less than $8 to make. As for the price tag, well, that's complicated.
It doesn't make any sense. You're trying to make sense out of something that makes no sense.
Anderson explains there's limited competition. In fact, according to that House committee report, just 3 drug companies make up 90% of the global market. And here are their list prices. About $275 for Humalog, made by Eli Lilly. About $284 for Lantus, made by Sanofi. And almost $290 for Novolog, made by Novo Nordisk. But these list prices set by the manufacturer are just the first piece of the puzzle. Insurance companies will then negotiate a lower price through pharmaceutical benefit managers, or PBMs. Our experts say they decide which drugs get a favorable placement on what's called a formulary, which is essentially the list of drugs your insurance will cover. So making these PBMs happy with big rebates is a huge deal for the pharmaceutical companies.
There's been this dance where the rebate goes up, the price goes up, the rebate goes up, the price goes up.
And if you have good insurance, this dance may not impact you much. You only see that reduced price, but it's a different story for those with a high deductible.
Until they've incurred $3,000, $5,000, $10,000, they're going to have to pay the list price, unless their insurance somehow has negotiated something for them, but that's not common.
As for those with no insurance at all, our experts say that they're often going to have to really pay up.
If you don't have insurance at all, you're going to be paying list price.
And Medicare patients who don't have Part D, the prescription drug plan, could be in the same boat. Now, our team did reach out to the 3 pharmaceutical companies and listen to their 2019 testimony.
List price is only part of the story.
They essentially argue that the list price is a red herring because it doesn't factor in the big rebates, adding that there are also discounts available for those with and without insurance. Although you have to apply for these discounts, and it's up to the pharmaceutical company if you're going to be approved. So we can verify that for the uninsured or people with a high deductible, the answer is yes. They would have to pay hundreds of dollars unless they get a discount.
What is that, right?
A shark.
Back in Alexandria, Popel says that he hopes the price of this important medicine will only go down from here.
You need it. If you don't have it, you're going to be hospitalized.
Now, we should note that there are cheaper alternatives out there, some from those same 3 big pharmaceutical companies. There are also efforts at the federal and state level to set a cap on prices. We dive into all of this on our website, and if you want to take a look for yourself, just text VERIFY to this number on your screen, and we'll send a link right to your phone.
Did you see that research that came out this week about alcohol use?
This TikTok video, viewed more than 4.8 million times, claims having an average of 1 alcoholic drink per day will cause your brain to shrink. So let's verify. Does booze shrink your brain? Our sources? The study the video is based on, and Dr. Henry Kranzler, who wrote it. We asked him point blank, can an average of 1 alcoholic drink a day shrink your brain?
That's a little sensationalist.
He says that's not what they found. In fact, that's not even what they were studying.
So we didn't look at people before they drank over a period of time and then after, which would be required to support that claim.
So we can verify, no, this study did not conclude that drinking alcohol shrinks your brain. But here's what they did find when they studied 37,000 brain scans. On average, those who drank more showed a decrease in what's called gray matter and white matter, which essentially means a lower volume of brain cells, and those cells were less organized. But Kranzler says that doesn't definitively point to permanent brain shrinkage.
There is evidence from people who drink very heavily, who have more functional effects and larger decreases, that with abstinence, there is recovery. Not full recovery, perhaps, but can be substantial.
So go easy this holiday season.
Absolutely.
All right. That's all the time we have for tonight. Hope you've enjoyed our WUSA9 Verify special medical myths and misinformation.
Remember, for all of our latest Verify content, you can log on to WUSA9.com/verify. For Adam Longo and our entire staff and crew, I'm Abby Larico.